Hello, how is everyone doing? Okay, so good afternoon, good evening, or good morning for whatever time you're watching this lecture. We are going to tackle on the region of the upper arms anatomy. Now, I hope this would be a very interesting session for all of my classmates because I would be using a simulation approach for my discussion of my topic now because during face-to-face kasi, turn on the skin. During face-to-face, other dental schools dissect a cadaver for their study on human anatomy. Siyempre, magpapatalo ba tayo? Of course not. Now, even during lockdown, I would want to provide you the outlook of dissecting a human. But sorry to say that it would only be limited to my topic. Nevertheless, I hope that you will still enjoy this session. Okay? Now, to start us up for the upper arm is Miss Lexine Grace Cabrera.
Good day, everyone. I am Lexin Grace Cabrera, and I am here to discuss the upper arm. For a short introduction about the upper arm is located between the shoulder joint and the elbow joint. So some may be confused regarding the upper arm and the forearm. A way to remember this is that the upper arm extends from your shoulder to your elbow, while your forearm runs from your elbow to your wrist. First is the superficial sensory nerves of the skin of the upper arm. For the nerves, we have 6 nerves. First is the supraclavicular nerves, which is located in the upper part, and it is the sensory nerve supplied to the skin over the point of the shoulder to halfway down the deltoid muscle. So the deltoid muscle po is a thick triangular shoulder muscle which should be located right here po. And second is the upper lateral cutaneous nerve. Ito po. And it is a branch of the axillary nerve, C5 and 6, and it supplies the skin over the lower half of the deltoid muscle. Third one is the lower lateral cutaneous nerve of the arm, which is a branch of the radial nerve, and it supplies the skin over the lateral surface of the arm below the deltoid muscle. For the fourth nerves, we have 2, the medial cutaneous nerve of the arm and the intercostobrachial nerve of the arm. So they both supply the skin of the armpit and the medial side of the arm, because as you can see in the figure, they are both located at the medial side of the upper arm. And lastly is the posterior cutaneous nerve of the arm. So it is also a branch of the radial nerve, C8, and it supplies the skin of the back of the arm. That is why it is called posterior. For the superficial veins, the veins of the upper limb can be divided into 2 groups. First, we have the superficial veins that lie in the superficial fascia, and second one is the deep veins that comprise the venae comitantes, which accompany all the large arteries that are usually in pairs, and the axillary vein. So what we have right here is the cephalic vein and the basilic vein. So they are both superficial veins and they both ascend in the superficial fascia, but for the cephalic vein, it ascends on the lateral side of the biceps, while for the basilic vein, it ascends on the medial side of the biceps. For the cephalic vein, upon reaching the infraclavicular fossa, it drains into the axillary vein, while the basilic vein, halfway up the arm, it pierces the deep fascia, and at the lower border of the teres major muscle, it joins the venae comitantes of the brachial artery to form the axillary vein. For the nerve supply of the veins, so gaya po ng arteries, the smooth muscle in the wall of the veins is innervated by the sympathetic postganglionic nerve fibers that provide vasomotor tone. So the origin po of these fibers is similar to that of those the arteries. For the superficial lymph vessels, the superficial lymph vessels draining the superficial tissues of the upper arm pass upward to the axilla. So those from the lateral side will follow the cephalic vein to the infraclavicular group of nodes. So what I have said earlier, ang cephalic vein po is on the lateral side. So ito po siya, and it will go to the infraclavicular group of nodes, while those from the medial side po will follow the basilic vein to the lateral group of axillary nodes. So ito po yung basilic vein, which is on the medial side of the arm, and it will go to the lateral group of axillary nodes, which is right here po. And the deep lymphatic vessels draining the muscles and deep structures of the arm drain into the lateral group of axillary nodes. On a clinical note, we have lymphangitis, which is an infection of the lymph vessels of the arm. And as you can see in the picture po, red streaks along the course of the lymph vessels is a common feature of this infection. Additionally, lymphadenitis. Once the infection reaches the lymph nodes, they become enlarged and tender. So, nagiging swollen po siya or namamaga. So, this explains the frequency of inflammatory edema and the abscess formation, which is the NANA. For the fascial compartments of the upper arm, so the upper arm is enclosed in a sheath of deep fascia. It has two fascial septa, one on the medial side and one on the lateral side. They extend from the sheath and are attached to the medial and lateral supracondylar ridges of the humerus. Thus, the upper arm is divided into the anterior fascial compartment and the posterior fascial compartment, which will be tackled on by the next reporter. So our focus for today is the contents of the anterior fascial compartment of the upper arm. For the overview of the anterior compartment, for the muscles, we have the biceps brachii muscle, the coracobrachialis muscle, and the brachialis muscle. For the blood supply, we have the brachial artery. For the nerve supply to the muscles, we have the musculocutaneous nerve. And for the structures passing through the compartment, again, we have the musculocutaneous nerve, the median nerve, and the ulnar nerve. Again, we have the brachial artery and the basilic vein. And lastly, the radial nerve, which is present in the lower part of the compartment. For the blood supply, we have the brachial artery. So this is the brachial artery, which is the cut portion, and it begins at the lower border of the teres major muscle as a continuation of the axillary artery. So ito po yung teres major muscle, and an important function po of this artery is that it provides the main arterial supply to the arm, and it terminates opposite the neck of the radius by dividing into the radial and ulnar arteries. So ito po yung it terminates at the opposite of the neck and divides to radial. Ito po ang radial artery. At sa kabila naman po is the ulnar artery. For the anterior relation of the brachial artery, so ito pong brachial artery na nasa gitna na kulay red, we have the coracobrachialis. So ito po ang coracobrachialis muscle. And of course, the biceps muscle. Ito po ang biceps muscle, which the vessel is superficial and is overlapped from the lateral side. We have the medial cutaneous nerve. This is the medial cutaneous nerve of the forearm and lies in front of the upper part. And we have the median nerve, which crosses its middle part. Ito po siya. It crosses the brachial artery in its middle part. And lastly is the bicipital aponeurosis that crosses its lower part. Ito po ang bicipital aponeurosis. Ito pong kulay white. And for the posterior relation, of course, we have the artery that lies on the triceps, the coracobrachialis insertion, and lastly, the brachialis muscle. So, ito po ang brachialis muscle. For the medial relation, we have the ulnar nerve and the basilic vein in the upper part of the arm. So ito po ang ulnar nerve, which as you can see is at the medial side of the brachial artery and at the medial side of the upper arm. And of course, again, we have the median nerve, which is located right here. So, was what I've said previously, nasa anterior relation din siya since pagdating po niya dito sa middle part ng brachial artery, as you can see, it crosses, so which makes it po na anterior relation. Pero as after it crosses the middle part of the brachial artery, it will run down toward the medial side po of the brachial artery. And again, for the lateral relation, we have again the median nerve. Since before it crosses the middle part of the artery, nandito po siya sa lateral side. And the coracobrachialis and biceps muscle above. And of course, we have the tendon of the biceps, which lies lateral to the artery in the lower part of its course. Ito po yung tendon of the biceps, which is near din po the bicipital aponeurosis. Ito po ang bicipital aponeurosis. For the brachial artery, we have 5 branches. First is the muscular branches. Ito po ang muscular branches. And to the anterior compartment of the upper arm, second is the nutrient artery, which is not shown in the figure, to the humerus. Third one is the profunda artery, which arises near the beginning of the brachial artery and follows the radial nerve into the spiral groove of the humerus. So kaya po nasabing it arises near the beginning of the brachial artery since siya po yung unang nagba-branch out or nag-a-arise sa brachial artery, as you can see. And fourth is the superior ulnar collateral artery, which arises near the middle of the upper arm and follows the ulnar nerve. Ito po yung ulnar nerve. And just below it is the inferior ulnar collateral artery, which arises near the termination of the artery and takes part sa anastomosis around the elbow joint. For the nerve supply, we have the musculocutaneous nerve. Ito pong yellow ang musculocutaneous nerve. And it runs downward and laterally, which pierces the coracobrachialis muscle. Ito po yung coracobrachialis muscle. And then passes downward between the biceps. So ito po ang biceps. And the brachialis muscles. Ito po ang brachialis muscles. And it also appears at the lateral margin of the biceps tendon and pierces the deep fascia just above the elbow. So, it runs down the lateral aspect of the forearm. So, matatawag na po siya as lateral cutaneous nerve of the forearm pagdating na po sa forearm and not as a musculocutaneous nerve. For the first structure passing through the compartment, again, we have the musculocutaneous nerve. Ito po ang musculocutaneous nerve and it has 3 branches. First, we have the muscular branches to the biceps, the coracobrachialis, and the brachialis muscle. Second is the cutaneous branches, specifically the lateral cutaneous nerve, which supplies the skin of the front and lateral aspects of the forearm down as far as the root of the thumb. Ito po yung lateral cutaneous nerve. And lastly is the articular branches to the elbow joint. Ito po yung articular branches. Second structure is the median nerve. Ito po yung cut portion ng median nerve just beside the brachial artery. And it runs downward on the lateral side of the brachial artery. And halfway down the upper arm, it crosses the brachial artery and continues downward on its medial side. So a way to remember this nerve po is that it crosses the brachial artery halfway down the upper arm. And this nerve is therefore superficial, but at the elbow, it is crossed by the bicipital aponeurosis. So, as you can see, superficial pa po ang nerve na ito, pero pagdating niya po sa elbow, dito po, it will be crossed by the bicipital aponeurosis. Ito pong kulay white. And it has no branches in the upper arm except for a small vasomotor nerve to the brachial artery. Second to the last structure is the ulnar nerve, and it runs downward on the medial side of the brachial artery as far as the middle of the arm. So, ito pong ulnar nerve, located on the medial side of the upper arm, and at the insertion of the coracobrachialis muscle, this nerve pierces the medial fascial septum accompanied by the superior ulnar collateral artery, which is yung nabanggit ko po kanina, which is a branch of the brachial artery, and ina-accompany niya po itong ulnar nerve and enters the posterior compartment of the arm. So, ang ulnar nerve po ay hindi lang present sa anterior fascial compartment, kundi present din po siya sa posterior fascial compartment. And it has no branches in the anterior compartment of the upper arm. For the last structure, we have the radial nerve. Ito po ang radial nerve. Nakarugtong lang din po ng axillary nerve. This is the axillary nerve, and upon leaving the axilla, the radial nerve immediately enters the posterior compartment of the arm and enters the anterior compartment just above the lateral epicondyle. So, gaya po ng ulnar nerve, ang radial nerve ay hindi lang present sa anterior fascial compartment, kundi present din po siya sa posterior fascial compartment. That sums up my report po. Once again, I am Lexin Grace Cabrera. Thank you for listening to my report.
Okay, so just to introduce to you with this software so that you'll be familiar, and also uh, for the general knowledge of everyone na rin. Okay. Malakas ng ulan. Okay, so I'm adding the muscles to our human model. Okay, yan. Now, if we are going to view it, zoom out, yan. If we're going to view it this way, you would see that the upper limb and the lower limb have some similarity in form, and that may be explained because of the embryological development is somehow similar of the two limbs, the upper and lower limbs. Now, it evolves. It involves din kasi the principle that once we start walking with our own 2 feet, that we are no longer crawling with the help of the hands, we have then gained a lot, and we have then gained and learned a lot of mobility, especially in the hands, diba? We have gained the knowledge of how to write, how to draw, how to perform other things. And for this past few months, we have also learned how to carve, diba? Uh, we have developed so much greater skills, mobility skills in our upper limb, which is why ito ang puhunan natin as future dental professionals, di po ba? So it is very important that we have a good amount of knowledge regarding this part of our body. Okay, so uh, I'm going to remove the muscular layer. Yan. And focusing only for the upper limb. Okay, so right here, I have dissected the other bones and removed it so that we will only focus here. Now, I'm starting first with a skeletal framework because I think for me it is essentially must be understood first because it provides a topography of its structures provides a topography of where the muscles are attached, where the vessels are situated, etc. And now for the previous reports kasi, the scope of the upper limb has already been mentioned, diba? From shoulder to hands. Now, we also have here the discussion of some parts of the thoracic wall, such as this, diba? Those structures such as the breast, diba? They contain muscles and vessels that are continuous with that of the upper limbs that are distributed throughout. Diba? For the muscles, we have those that build the axillary wall, and for the vessels, we have those continuous.
I'm very sorry, but it would appear that I have been cut off because of a sudden power interruption, ano? Maybe brought by a heavy rainfall. But okay, so let's continue the discussion of the overview. Now, I think the last thing I mentioned is about the bony pectoral girdle, which is composed of, no, this is, again, the pectoral girdle is, we commonly know it as the shoulder region. Yeah, right here. Yeah, okay. And if we're going to view its skeletal framework, it is composed of the the clavicle in its anterior portion, as well as the clavicle in the anterior portion, and with the acromioclavicular joint right here. Okay, so I'm going to show you that the figure of the acromioclavicular joint. Mhm. Zooming in, and that is the acromioclavicular joint, which allows the articulation of the clavicle with the scapula. And again, the scapula is the posterior portion naman of the pectoral girdle. Now, we have the first reporter have also mentioned about the breast. So why is it important that it is discussed in the upper limb? It is because that the pectoral region is composed of muscles as well. That is continuous, and that is attached to the upper limb, and the breast has protruding vessels which are continuous as well in the upper limb, especially in the axillary region. So I won't expound much of that because it has already been discussed naman. So, but let's focus in this region naman, the arm. Okay. Again, we usually don't dress it as the upper arm because in our anatomical term, the arm uh, already refers to this portion. Okay. So if you're going to observe, there's a glowing red right here and parang may crack dito, which I would explain later. I put it in there to somehow capture attention if you're watching this. Okay. So uh, this is the shoulder joint, and I will remove it to um, and it now shows the glenoid fossa and the head of the humerus right here. Now let's start discussing its anatomy na. Now again, this is the humerus, which is the only bone for the arm. Iisa lang siya. And its most terminal portion on its proximal end is called the head of the humerus. Okay, let's isolate that. Okay, now, now the head of the humerus, yan, which is highlighted in pink. Again, it is the smooth spherical leg, which is at the proximal end of the bone, which articulates with the glenoid fossa, along with the help of course, the shoulder joint. Uh, Now, this head that is covered with articular cartilage, if you're going to remember, and along with the glenohumeral joint, or what we call the shoulder joint, it is connected to the scapular region. And immediately below it, right here, we have the anatomical neck, yan namang highlighted in pink as well. Now, the anatomical neck is, in Snell, it is referred to as what the structure immediately below the head of the humerus, and for here it connects head of the humerus to the body. Now, why do we call it the anatomical neck? Ano? It's seemingly because we have two necks in the humerus. Now, it would very much explain why there is a crack right here, because this is what the region of what we call the surgical neck. The surgical neck that is immediately below this two prominent area right here. But we're going to discuss this first now. This prominent area, or of the eminence in the humerus, is what we call the tubercles. Now this portion right here, the eminence, the bigger one, now the large eminence found on the lateral aspect on the proximal end of the humerus is the greater tubercle. Now, take note of that lateral aspect, huh? Lateral aspect on the proximal end is the greater tubercle, while the eminence in the anterior aspect of the proximal end of the humerus is the lesser tubercle. Now, this is the smaller one, the smaller eminence compared to that of the greater tubercle. Hence, it is named as lesser tubercle, diba? And then immediately below it is the surgical neck. Now, the surgical neck, it is named in that way because it is the most common site for fracture, or hence surgery, diba? Right here, it is fractured. Actually, it's not that real. The surgical neck is composed in this is actually, the surgical neck is in this portion, yeah, that whole portion. So I only fractured this area just to give you the overview of what it looks like when the bone is fractured. Now, di ba, if you're going to remember in our discussion in Fascial last year, it has been brought up, is that even if the bone is fractured, it would always restore, di ba? There's resorption, and the cells that are responsible for those are the osteoblasts, osteoclasts, and osteocytes. And for this naman, di ba, it would still inflame before it heals pa. Okay. So not much of that. Okay, asin ko na tong pain. Yan. And then the fracture, I will clear that. Yan. So again, the surgical neck is that is most common site for fracture. Hence, it is named as surgical neck. And the anatomical neck is the portion that is immediately below the head of the humerus that connects the head of the humerus with with its body. Okay. So going back to the tubercles, now they have their own corresponding crests, which is immediately below them. Now for the crests naman, they provide a site for insertion of muscles. For the crest of the greater tubercle, yan, highlighted in green. Now that is the longitudinal ridge, located on the anteromedial aspect of the greater tubercle, so anterior and anteromedial, and it provides the insertion site for the pectoralis major muscles, whereas the crest of the lesser tubercle naman is on the posterolateral aspect of the uh, lesser tubercle. You see, this is the lesser tubercle. Yan. Moving my cursor around it, and in the posterior portion of it is its crest, which provides the attachment for the attachment or the insertion site for the teres major muscle. Now, immediately below those crests of the surgical neck, ito yung surgical neck again, yan, highlighted in lilac. Lilac ba yan? Or ano ba yan? We have also the deltoid tuberosity, which is another prominence. It is a triangular prominence found on the middle third of the anterolateral surface of the humerus, which provides the insertion site for the deltoid muscle. Also, that one is easy to remember because deltoid tuberosity provides the insertion site for the deltoid muscle. Kasi pareho naman niya ang pangalan. Okay. So for the next one, we have the spiral groove. Now, in this, we name it as the groove. In this reference, it is named as the groove for the radial nerve because that's its function. The spiral groove is the oblique depression, found, yeah, it lies obliquely, found along the posterior surface of the humerus. Now, it is also described here as shallow kasi medyo mababaw nga lang naman yung kanyang mababaw lang yung kanyang depression in this area because it only provides the passage for the radial nerve as well as the deep brachial artery. Now, the deep brachial artery, please take note, it is also called as the profunda brachii artery. And then we have also the epicondyles. I think we have I have to discuss first the lateral portion because before we go on epicondyles, there is the supracondyles first. Now this is not mentioned in the book as far as I remember, So we have the lateral and the medial epicondyle. Now, medial epicondyle, when we address in the humerus as the medial portion, it doesn't necessarily mean that it is in its middle part. Because remember that this is the basis of this position is in the anatomical position. The medial portion is always that of proximal to the midline of the body. So when we pertain to a medial portion in the humerus, it is most likely in this part. Yan. Kung saan mas malapit. And then the lateral portion is kung saan mas away from the midline. So take note of that. And before we go on to the epicondyles, uh, the supracondyles must first be understood. Now, it's not mentioned in the book, but I will still explain it here kasi may hirapan sa ibang definition because other references mentions it. Now, first we have the lateral uh, the lateral supracondylar ridge of the humerus. Now, it is a ridge, it's a sharp prominent margin in the lateral surface, the lateral aspect of the distal end of the body of the humerus. So this is that red one that highlighted in red. So yung walang highlight, ibig sabihin, that is the medial supracondylar ridge. Now, this lateral supracondylar ridge kasi provides the origin site for the brachioradialis and the extensor carpi radialis longus muscle, which would be tackled for the next reporters naman. And it is also an attachment site for the lateral intermuscular septum of the arm. It is mentioned, I will mention it later in the fascial compartments. Okay, so for the medial naman, the medial supracondylar ridge, yan, the one highlighted in, is this orange ba? Ano ba to? Yan. Now, the medial supracondylar ridge is of course in the medial aspect of the distal end of the humerus, the body of the humerus. Now, it provides the origin site for the pronator teres muscle and attachment site for the medial intermuscular septum of the arm. Those intermuscular septum is part of the deep sheath of fascia for the fascial compartment. So later, we're going to tackle much on that. And then for the epicondyles, okay. So this is the medial epicondyles at the terminal end of the medial supracondylar ridge, yan. And it is a subcutaneous projection, which is it is a subcutaneous projection which contains the groove for the ulnar nerve and also provides the origin sites for the superficial group of muscles of the anterior compartment of the forearm, which again would be tackled by the next reporter pa. And it is also the attachment site for the ulnar collateral ligament. And then in its opposite side, we have the lateral epicondyle of the humerus. Just like the medial epicondyle, it is on the terminal distal end of the lateral supracondylar ridge, and it is smaller than of the medial epicondyle, and it provides the origin site for the superficial group of muscles of the posterior compartment or the posterior fascial compartment of the forearm and the supinator and anconeus muscle. And it also provides the attachment site for the radial collateral ligament. And then we have three fossa. Okay, if nakikita ba? There's a depression, right? Yan. This two, these two depression above, um, beside the epicondyles. Okay. So for those depression, we have the fossa, and in the anterior aspect, we have the coronoid as well as the um, so for the anterior aspect, we have the coronoid and the radial fossa. The coronoid fossa is here. Yan, yung highlighted in green. The one that is superior to the trochlea. This is the trochlea, itong violet. Now, this accommodates the coronoid process of the ulna during elbow flexion, whereas the radial fossa naman, of course, by its name, it assists or accommodates the head of the radius during elbow flexion as well. Now, I'm sure that you're familiar with the radius and the ulna because they are the only bones of the forearm. And for the ulna is the one that corresponds in the direction of your pinky finger. Ito, the one right here, and the radius is the one that corresponds with the thumb, the direction of the thumb. So that is one way to remember it. And then up in the posterior portion naman, we also have the olecranon fossa or olecranon fossa. Okay, so it is the large deep depression in the posterior aspect of the condyle of the humerus, formed by the concave of the posteromedial surface of the greater trochanter. It accommodates the olecranon of ulna during elbow extension naman. Now, that is when they vary. Now, olecranon fossa not just being in the posterior portion, the physiology of it is that it accommodates in elbow extension, while and the uh, the radial and the coronoid fossa accommodates their corresponding bone for elbow flexion. And then finally, this uh, these two structures right here, the capitulum and the trochlea. So the trochlea is the one that is pulley in shape. Yan, yung medyo may concave siya dito sa gitna. Now, it is found in the inferomedial aspect of the condyle of the humerus. Now, take note of that term, inferomedial. So the other one is inferolateral, which again, medial means closer to the midline of the body, and lateral meaning away from the midline. Now, the trochlea of the humerus, ito, again, articulates with the trochlear notch of the ulna, which forms the humero-ulnar joint, which contributes to the formation of the elbow joint. And for the other one, we have the capitulum, which is convex in shape. Yan. It is a convex projection found on the inferolateral aspect of the condyle of the humerus. Now, it articulates with the head of the radius, which also forms the humeroradial joint, uh, and contributing to the formation of the elbow joint. Okay, so that's it for the humerus. Okay, is that a pain? Pain ba yun? Now, I've added those information in my PowerPoint because I think it's a little wala kasi siyang definitions and descriptions of the structures, but just for your additional information, I have added it as well. So I'm here on Zoom again. To continue the upper arm, started by Ms. Cabrera, ano? So I have already given you the recap, and I have already given you the discussion regarding the humerus. So I think I don't need to expound myself on this pa. This is the illustration. I've already labeled it myself. Yeah, this is my work. Okay, okay, tama naman. And these are the added definitions because I've updated my PowerPoint presentation kasi I understand that not all can watch this discussion. So these are what I have mentioned a while ago. Yes. Now let's go to the posterior fascial compartment. Ano? Now, what is a fascial compartment? First, you see the upper limbs are composed of two segments. Each limbs actually are composed of two segments. For for the upper limb, it is majorly composed of the arm or the upper arm, just as referred to in here by Snell, but we're going to refer it again as arm, huh? So for the arm, we have the anterior and posterior fascial compartment, and for another two for those of that forearm. I think the same rule goes on with the lower limb for the femur and the leg and the portion of the leg. Okay, so a fascial compartment is the section of a part of the body which contains nerves, blood vessels, and is surrounded by fascia. Now, in anatomical study kasi, the segments of the limbs are cut transversely and will divide into the multiple sections, which are the fascial compartments. So it usually has different or separate nerves and blood supply to other compartments. Other compartments meaning posterior and anterior fascial compartments. Also, a while ago, Ms. Cabrera has discussed about the anterior fascial compartment of the arm, and it is a little bit different for the posterior fascial compartment, okay, as reiterated here. So the fascial compartment of the upper arm is again enclosed in a sheath of deep fascia and has two fascial septa. So what do we mean by septa? Okay, so to reiterate, a septa is something that separates or divides or acts as a wall to divide or separate structures. So, kasama na rin to sa discussion ni Ms. Cabrera kanina, but this is the illustration, ha? Okay. The drawing tayo. Okay. The medial fascial septum is right here. Yan. Yan. The medial fascial septum. Yan. Okay. Okay. Take note that not all the green portion in this illustration is a septum. Kasi this one that is surrounding them is the fascia, the deep fascia. Okay. So the medial fascial septum attached to the medial supracondylar ridges of the humerus, whereas the lateral fascial septum is here. It's also called this lateral intermuscular septum. Yeah, and the portion right here is attached to the lateral supracondylar ridges of the humerus. Now, in this illustration, here all drawings. Now, in this illustration, we could see where is the fascial compartments. So, kasi ang muscles na kay Miss Cabrera sinabi kanina, okay, it extends from here, no? So, from the artery. This one. Yan. Anterior fascial compartment. Okay, kita ba? I think I shouldn't have used red. Try ko blue. Yeah, hindi pa rin kita. So yan, yung dinodrawing ko. That is the area of the anterior fascial compartment. So as you can see, there's more nerves in there compared to that of here, the posterior fascial compartment. Okay, here. So proceeding to the posterior fascial compartment, actually it is very easy lang kasi uh, its contents compared to the anterior fascial compartment is kakaunti nga. And it's the muscles for the posterior fascial compartment, I'm telling you, is only one group. And it is composed of three segments as well. So we have the long head, the lateral head, the medial head, all just by the triceps brachii. Okay, so you can see the image right here is from, again, the uh, Elsevier virtual anatomy, the one that I'm showing kanina. Don't Okay, so the long head, yan sila. This is the long head, which originated at the infraglenoid tubercle of the scapula, yun, yung pinakamahaba dyan, kaya nga long head eh. And then lateral head on the side is the origin. It originated at the upper half of the posterior surface of shaft or the humerus. So the origin is within the humerus itself, whereas this medial head cannot there's some difficulty in showing because it originated at the lower half of the posterior surface of the shaft of humerus. So medyo taklob siya nitong lateral head dito. Okay. So ito siya in the illustration of Netter. Hindi mapakita ang medial head niya kasi natakloban. Okay, so this is the posterior portion, ha. This is the long head. And then the lateral head. Okay, natakloban yung lateral head. Okay, so for this illustration that I found on the internet, it shows a portion of the medial head, yeah. So as you can see, this one, the long head again, originated at the infraglenoid tubercle of the scapula, whereas the lateral head originated at the upper half of the posterior surface. And then this one cannot be seen in this portion, but the origin again is at the lower half of the posterior surface of the shaft of the humerus. And then we have some muscles right here, the teres major, where it is inserted in the crest of the lesser tubercle, just like what I've mentioned kanina. And for the crest of greater tubercle, dun ang site for insertion of the pectoralis major muscle. Okay. So, iisa lang ang insertion ng lahat ng to, which is the olecranon process of ulna. And the nerve supply is iisa lang din, the radial nerve. And their action is iisa lang din, which is to extend the elbow joint. So, yan. This is the chart that I made, the Moina. If you're familiar with that, if my friends kayo sa PT or on other medical programs. So it's very easy to remember the muscular contents of the posterior fascial compartments because it's just one with three groups. Ang sasauluhin nyo lang dyan actually is the name and then the origin and then iisa na nga yung insertion, nerve supply, and action nila. Okay, so demonstration again. So just to show you this, the structures of the fascial compartments of the arm. Yan, I've already dissected the other muscles of the arm. Kasi I haven't showed it here because it's very hard. It takes a longer time to dissect it actually. And I've added in here the radial artery. Now, I know the radial artery is part of the anterior fascial compartment, but it is also would be reiterated in here because it has branches that could be found in the posterior fascial compartment. So I'm just going to add here the very source of the arteries, which is the heart. Okay, yeah, that beating heart. Okay. So you see here the subclavian artery becoming the brachial artery. And then, okay, so the ulnar nerve as well. Okay, the profunda brachii. The profunda brachii. Yes, you could just search your uh, specific structures and it will pop up, and it has information. It will display informations on the side, but still, as well as the ulnar vein, the ulnar nerve. Yan. And lastly, we have another nerve, the radial nerve. Okay, so why am I showing this? Because these nerves actually are those that are passing through the posterior fascial compartments. Yan. Okay, so that is the radial nerve and the ulnar nerve. Okay, so onti lang siya, oh. Now, if we are going to see it in a posterior aspect, again, this is the long head, yung pinakamahaba. And then this is the lateral head, and lastly is within them is the medial head of the triceps brachii. Okay, so it has no illustration talaga. Okay, so they have only one insertion, only one action, only one innervation, and arterial supply. Oh, pala. So I haven't mentioned the arterial supply pala. The blood supply of these muscles are the profunda brachii artery as well as the ulnar collateral artery. So to be specific, for the medial head, it's the deep brachial artery or the profunda brachii nga. And for the lateral head is the posterior circumflex artery plus the profunda brachii artery. Okay, so the deep brachial artery and the profunda brachii artery is actually one. Okay, same lang sila. Okay, iba lang name. And then for this one, you have the deep brachial artery as well, the superior ulnar collateral artery, and the posterior circumflex humeral artery. Okay, so I guess I have okay. So this is the profunda brachii artery, ha? Okay, yan. The one that is highlighted in pink again. Yung nailaw. So it branched off from the radial artery. So the radial artery is again part of the anterior fascial compartment. But I've mentioned it here because nga the profunda brachii is its branch. Okay. So any more interesting parts of the posterior fascial compartments? I think none yet, but I would be expounding on discussing further regarding the structures in the PowerPoint. So just showing you the software. Yan ang major branches of aorta, of the heart. Yan. Okay. So back to Zoom. So we're finished with this na. We're finished with the structure with this overview na. But now let's tackle on the structures that pass through the posterior fascial compartment. And first is of course the radial nerve. Now the radial nerve is actually right here. If you can see the laser, this is the radial nerve, the one that is on the lateral part. Radial nerve, and this lies behind the axillary artery, and it originated from the posterior cord of the brachial plexus, and it runs around the posterior fascial compartments in the spiral groove. If you're going to see it below, the spiral groove is shallow oblique depression on the medial aspect of the humerus. And as you can see right here, it runs down in an oblique manner as well, the radial nerve. So, uh, it supports this statement naman. And the radial nerve pierces the lateral fascial septum above the elbow, to, and continues downward into the cubital fossa in front of the elbow between the brachialis and the brachioradialis muscle. Now, it has branches in the axilla, spiral groove, and the anterior compartment of the forearm. So later on, I'm going to show you the branches. And then we also have the radial artery and the ulnar artery, which arises from the medial cord of the brachial plexus and, descends in the interval between the axillary artery and vena. Be very wary because itong naka-display na to, itong nerve na ito is the radial nerve, and the ulnar nerve actually cannot be seen in this illustration. So ito siya, radial nerve, yan, tago, nakatago. Uh, it arrives from C8 and T1, and it descends behind the septum, covered posteriorly by the medial head of the triceps. So, hindi talaga siya makikita dito. Now, it runs around the posterior fascial compartments in the spiral groove on the back of the humerus between the head of the triceps. Now, ito pala. So, this one, yan, ito. That one, yung mas evident, yung mas kita. So, this is in the anterior portion, showing only the muscles of the posterior fascial compartment. And ito. So this is the ulnar nerve and this is the radial nerve. Okay? It lies behind the medial epicondyle of the humerus and has an articular branches such as in the profunda brachii artery or the deep brachial artery, as well as in the superior and inferior ulnar collateral artery. Now, the branches naman. So, as I've mentioned, radial nerve has the branches in the axilla, which is, it is distributed in the long and medial heads of the triceps, and in the posterior cutaneous nerves of the arm. And wala siyang illustration again dito, but I think I have to show you the illustration and the virtual simulation. Now, in the spiral groove, the radial nerve is branched to the lateral and medial heads of the triceps and to the anconeus. The lower lateral cutaneous nerve of the arm supplies the skin over the lateral and anterior aspects of the lower part of the arm and in the posterior cutaneous nerve of the arm. So, the lower lateral cutaneous nerve of the arm is ito ha. This is the radial nerve, as I have mentioned a while ago, and this is the lower lateral cutaneous nerve of the arm, and this one is the posterior cutaneous nerve of the forearm kasi it goes continuously to the forearm, ha? And for the anterior compartment of the forearm naman, the radial nerve is distributed to the brachialis, the brachioradialis, and the extensor carpiradialis longus muscles. And it also has the articular branches to the elbow joint. Okay, so the branches naman of the ulnar nerve, it has an articular branch to the elbow joint, and it correspondingly distributed along these two arteries. So for the profunda brachii arteries, or otherwise known as the deep brachial arteries, it accompanies the radial nerve through the spiral groove and takes part in the anastomosis around the elbow joint. So this is the profunda brachii artery, ha. Ito, medyo maliit siya. As you can see the laser. Okay, I'm going to draw on it. So that one is the profunda brachii artery. And then we also have the superior and inferior ulnar collateral arteries, which arise from the brachial artery and takes part in the anastomosis around the elbow joint. So this is the superior ulnar collateral arteries, and this is the inferior ulnar collateral arteries. Now, another fact about these two arteries is that they are the blood supply of the contents of the posterior fascial compartment. So take note of that, the profunda brachii artery and the ulnar collateral arteries are the blood supply of the contents of the posterior fascial compartments of the arm. Okay, so next one. And then we have the cubital fossa. Now the cubital fossa, is the triangular depression that lies in front of the elbow. So this, ito, yan, di ba may triangle dyan? Yan. So it is bounded by the brachioradialis muscle and its lateral portion. Ito, lateral. So this is the brachioradialis muscle. And the pronator teres muscle on the medial. Yan. This is brachioradialis. And the pronator teres muscle ay iyang nasa medial portion. Next. So, ito ang kanyang specific boundaries as its base. The base of the triangle depression is the imaginary line between the two epicondyles of the humerus. So, nasan ba yung epicondyles na yan? Di ba ito? Yan. Ito tayo imaginary line. Yeah. Okay. And then the floor is the supinator muscle laterally and the brachialis muscle medially. Okay, so actually if hindi natin makikita dito yung yung floor kasi it is these two muscles are in the deep portion of the body. But it could be said that it is right dito lang siya. So the floor naman siya and the brachialis muscle is only extend from here, okay? Kasi di ba the brachialis muscle is from the anterior fascial compartment. So, and it is inserted in this portion. Yan, so ganon. And the supinator muscle nandito siya sa deep portion of that. And then of course the roof is the skin and fascia. Ito yung mga fascia but the skin is not shown here kasi nga this is a dissection, an illustration from Netter. Now, ito ang contents of the cubital fossa. Now, again, medially, this is the portion for the medial side, and this is the lateral side. Medially to lateral side, it has the median nerve, as well as the bifurcation of the brachial artery into the ulnar and radial arteries, the tendons of the biceps muscles, and the radial nerve and its deep branches. So, I won't show it much to you kasi on the next part here, I would be showing you again the virtual simulation of those structures. And we also have the supratrochlear lymph node, which again is not shown in here. But this portion, this structure pala rather, it lies in the superficial fascia superior to the fossa above the trochlea. So, nandito siya, di ba? Somewhere here. Yan. Pero, I think it's not displayed. Sorry, ako yun. I think it's not displayed here. So, we really need to have a virtual simulation on that. And its function is to receive the afferent lymph vessels from the third, fourth, fifth fingers, as well as in the medial part of the hand and in the medial side of the forearm. Okay. So just to show you this bifurcation first. Previous. Ito siya, okay? So that bifurcation of the brachial artery is actually this portion. Pointer. Yan. This portion. This is the brachial artery. And it bifurcates into the ulnar arteries and the radial artery. Okay. So I did promise again the virtual simulation, ano? Okay, I'm going to show my. Yan. Okay, so let's start again from the from the nerves. Okay, so I think the nerves are actually clear na kasi it has an illustration naman from Netter. But let's take time on the cubital fossa. Okay. So the cubital fossa, I have already shown you its boundaries na. So not much on that. But for the, let's have the clarification on the base, ha. So as it mentioned, the base, the floor rather, the floor of the fossa is formed by the supinator muscle in the lateral portion. So this is the this is that is the supinator muscle, and in its medial portion is the brachialis muscle. So ilagay natin dito. That is the brachialis muscle. So dahil nga ang floor niya is just beneath, in between the epicondyle, so probably it's just in this portion. Okay, so pansin natin ulit siya. And for the contents of the cubital fossa naman, so I've only showed you the bifurcation of the brachial artery, correct? But ang median nerve, the median nerve kasi it's not on the posterior fascial compartment, but in the median nerve is yan, yan ang content. So medially, di ba, kaya dyan nagsimula. The medial side of the on the medial side of the cubital fossa, it starts from the median nerve, yung highlighted in pink again. And then we have the bifurcation of the brachial artery, which is not shown in here. But if you want to see it, sige, brachial artery. Yeah, that is the brachial artery. And if it bifurcates, let's show them. Yan ang bifurcation. So this one, this portion is the radial artery, and this is the ulnar artery. And we also have the tendon of the biceps muscle. So I think hindi siya, wala siya dito. But if we go back to the PowerPoint, kasi malilito lang dito eh. As well as in the radial nerve and the deep branches. Ito ang radial nerve. And ito yung deep branches niya. Yan. Okay, so for the supratrochlear lymph node naman, as I mentioned, wala siya kanina dun sa given illustration, but it is here. Ito. Diba? Katabi lang siya ng trochlea. Malapit siya sa trochlea. Yan. That is the supratrochlear lymph node. Okay, so going back to the PowerPoint. So I have included in my report, again, I have included in my report Venipuncture. So that's me having taking my first ever bloodletting sa LPU last year. And I've inputted in here a clinical case kasi it is mentioned in the book, although I think na hindi naman to siguro matatakal sa future major exams kasi venipuncture is not really our field, di ba? Kasi pang medtech to, and na it's just one of the clinical notes sa SNEL. So I've also inputted in here because it's a very interesting it is a very interesting topic. So the clinical case, it is the patient undergoing bloodletting for the first time filled up a pint of blood in less than 2 minutes. What could be said regarding the movement of the venous blood flow and what possible factors may have affected it now? Personally speaking kasi, I've consulted with my friends, medical technology field, and they've mentioned that the review of the blood supply, these are the blood supply of the arm, okay? Wait lang, where's my pointer? Pen. Okay, again, this is the axillary artery. The axillary artery becomes continuous with the brachial portion of the body as the brachial artery. Yan. This is the brachial artery. And then the branches are the muscular branches, the nutrient artery, as well as the profunda arteries, and the superior ulnar collateral arteries, and the inferior ulnar collateral arteries. And for the veins naman, we have the cephalic vein, the lateral portion, ito yung cephalic vein. Yan. Then the basilic vein in the medial portion. And then the median cubital vein, ito. Yan, median, meaning siya yung nasa gumigitna beneath the cephalic and the basilic vein. The vena comitante is not actually shown here. And of course, the axillary vein, of course, nasa axilla siya. Yan. Now, in the venipuncture, it is defined as the process of obtaining intravenous access for collection of blood for laboratory testing or transfusion. Now, why is it a vein? Now, of course, kasi venipuncture now, the more proper question for this one is, why is that blood transfusion is usually a venipuncture? Because you see the vein is a good indicator of physiological conditions throughout the body and is relatively easier to obtain. Diba? Vein delivers the oxygenated blood. So, all wastes ay naka-display dyan for sure. But and on the other hand, it is mas madali siyang kuhanan ng dugo. And though there are still different types of blood samples because sometimes phlebotomist opts for depending on the requirements, phlebotomists would rather have blood sample from the arteries or from the arteries or from other vessels, 'di ba? Depending on what maybe depending siya sa kung anong kailangan ng doktor. Okay, so that's it. So if you have questions, please feel free to ask us lang, any reporters. And yun lang. So, gets ba? Gets ba natin? So again, if you have any inquiries, just feel free to message me in some messenger or any of the reporters regarding our topics, and to lighten everyone up in this very unprecedented situation kasi nabagyo na, may COVID pa. So ito ang masarap sa eyes. For us dentist, masarap tingnan ang magandang ngipin. And for phlebotomist, ang masarap tingnan ay ito. Yan.